Community Regional Medical Center is one of just 68 hospitals in the country that recently took part in a collaborative effort to help improve practices within intensive care. It's called the ICU Liberation Group, and it was done through the International Society for Critical Care Medicine. Basically, the team broke down practices from pain management to physical therapy. We sat down with Dr. Krista Kaups, Director of Surgery ICU at Community Regional, to find out what they learned and how it's improving patient care across the board.
Well, we see some really seriously ill, critically ill and injured patients in our ICUs. And as we've taken care of patients, we are always trying to do what we can to reduce the time that people need to spend getting support from ventilators, and also trying to shorten the time that they need that kind of intensive care. Our implementation actually went over about a 2-year period, and the actual collaborative ended about a year ago. What we've been really pleased about is that our trends, as we've looked at our stays, our use of medications, have continued to decrease. And I think that's really important for all of us as we're working together on this, is that people have been able to sustain our change in practice and what we've been doing for that. We're certainly the only hospital in this part of California that was invited to participate, and we were recognized for some of our particular efforts in reducing the amount of medications we're using. We used to think that keeping people completely sedated and out of it was really the better way to go, so they wouldn't remember what happened to them. It turns out that the more of those medications we give, that it actually can lead to things like delirium, which is confusion and disorientation. And so we've, with the help of our pharmacists and nurses, really taken a careful look at that. Our goal is for our patients to be awake but comfortable, not frightened or agitated. And we're also working to more aggressively get people off the ventilators. And I think also the idea of mobilization, having people sitting up in a chair, exercising their muscles. We realize that's not only important from a breathing standpoint, but it's also good for their orientation, for knowing where they are. You know, one of the really important things that we know is that if you just put somebody to bed without being ill, without being injured, that they may lose 50% of muscle mass in a week's time, and that's without all these other things going on. So we really realize how important it is to get people up and moving, exercising, using their muscles to prevent them from atrophying, from wasting away, and also to allow them to breathe well, to move well. And so that really is an important part of that as well. It really helps reinforce that a hospital or an intensive care unit is so much dependent on the efforts of the team, and that means everybody. And that includes the patient's family, the physicians, nurses, pharmacists, respiratory therapists, physical therapists, nutritionists. It's the way that we provide the best care for our patients. It's the way that we work to see them not only survive, but thrive afterwards.